if a person is deficient in a vitamin because, for example, if they're using GLPs, they're often deficient in B12. Welcome to the Institute for Ageless Living in Longmont, Colorado. We're going to discuss vitamins and IV therapy. We have designed a program where we institute both IV therapy and vitamins for a tailor-made, individualized system depending on the patient's symptoms and what's going on after a thorough evaluation. We use all the vitamins, including the B vitamins and even the fat-soluble vitamins, vitamin A's and D's, and some other peptides with our IVs, but all of that we have designed to institute a individualized program for the IV and vitamin therapy, because you can't really do one without the other. We evaluate the person for their individual needs. If a person is deficient in a vitamin because, for example, if they're using GLPs, they're often deficient in B12 for absorption of B12 in the stomach. So if a person that's on GLPs, we evaluate them more and we give them the vitamins that they need in IV fluids that help replace some of the fluids they're losing also. A lot of it depends on the individual's needs, but they're designed to replace the vitamins that a person may be losing because of a certain condition, because of diet, because of exercise, and based on what we evaluate, we treat a very tailor-made program for that individual. I mean, absolutely every benefit that you can imagine. Increased appetite, better feeling of well-being, better general health, and lack of or a alleviation of physical symptoms of vitamin deficiency. And those are all included in the program that we individualized. The differences with IV is you get a better absorption, quicker result, and you also, with the IV, you get fluids along with it. Very, very frequently, if somebody isn't eating enough, they're usually not taking enough fluids in at the same time. And it enhances the efficacy of the vitamins themselves. We see everybody from people that get a little hungover on the weekends and want to replace fluids and some of the vitamins that intake of alcohol can deplete, to individuals who have bona fide medical problems that cause them to be deficient in certain vitamins, or they have lifestyles that make them deficient in certain vitamins because of their strenuous exercise or a strenuous lifestyle. There's actually no real preparation. We prepare you by doing a complete evaluation. It would benefit us if you come with any records you have, any lab tests you have that you've taken from other providers, any other therapies you've done, because we will evaluate all of these things to tailor-make your program. Everybody that comes in will be first given a 30 to 45-minute evaluation. And after that, a treatment plan will be outlined and explained to the patient. Alleviation of vitamin deficiency issues will be the first thing you can expect. And other than that, many medical conditions that result from having vitamin deficiency, including things like vitamin C deficiency, which is scurvy, to vitamin B12 from the use of GLPs, all of these things will be alleviated by giving those vitamins and also hydrating the person up and having them feel much, much better once they get their fluid levels up. Anybody who is interested in IV therapy and vitamin therapy, please look at our website. You can study our website, and we have a provider that specializes in IV therapy and vitamin therapy that can talk to you and see you on evaluation if you choose to come in and schedule an evaluation before even treatment starts.